Hello everyone, welcome to another episode of the Halak Show. We are in season 3 now, and oh boy, we have a guest today. She is a dentist, and there are a lot of questions that I had in my mind, or I had read, or somebody would have told me, which I thought were true until today. And today is the day when I debunk some of these with her. So, episode is packed with information, knowledge, and I'm pretty sure there is one thing in that episode which will come later in the episode which you did not know. Or if you are a dentist and you were into dentist school, you might have an aha moment. So with that being said, let's get on with the show. Let's welcome my today's guest, Dr. Roshni Shah. All right, so Dr. Roshni Shah, welcome to the show.
Thank you.
The Halak Show. Lots to talk about. Let's start with something very serious. What do you say to those people who say dentists are not real doctors?
That's a great question. What I say is, okay, you still have to call me doctor. So that's really up to you whether you believe that dentists are doctors or not. But we go to a lot of schooling to be called doctor. So
Yeah. I mean, those people, I think they are not thinking through it right, because
yeah,
you are the doctor who has the power to pull the teeth out.
Yeah. The thing is, like, doctor is such a broad term. It doesn't have to be just like a physician, like a medical doctor. Lawyers are like juris doctor.
Right.
There's doctors of physical therapy. There's
PhDs.
PhDs are doctors. So
Right.
it's just having mastery in a field at a level of, a graduate level is what we call doctors. So I wouldn't say I'm a doctor in any sense of like, I can't treat someone's foot or something like that. But in terms of someone's
Right.
teeth, I think, I have
It's
that.
just wise to just say doctor.
Yeah. So
And,
I don't know.
right.
I think people like take it very seriously where they're like, oh, like you're not even a real doctor. Like, okay.
All
Like,
right.
it
Just
is
the
what
funny
it is.
thought that I
Yeah.
had, I wanted to always ask a doctor,
Mhm.
what do you say, or what you guys might also have insider jokes
Yeah.
about, like, internal medicine specialist, them calling doctors. But
Yeah.
before we get into like some easy stuff,
Mhm.
one more very serious question. As a child,
Mhm.
when I broke my tooth for the first time,
Yeah.
my dad and my mom said, put on the pillow,
Mhm.
there'll be a tooth fairy.
Yeah.
Is it real?
No, unfortunately not. It's just mom and dad.
Where does it come from?
I think it was just like a way to get kids like hyped up for like losing their teeth. Like, okay, like it's okay. You have a loose tooth. You can just get money for it. And so it became a thing. That's at least what my parents taught me. And they were like, oh, you can get like $1 or 25 cents or whatever. And so that's just how it became. But I don't know the origins of it,
Till
honestly.
date, my mom doesn't tell me the truth.
Really?
Yeah. I got a car because I was very fond of cars.
Yeah.
So I woke up in the morning, I had a car.
Okay.
My tooth was
like
not
the
there.
little, yeah.
Like the playing cars.
Yeah, yeah.
7 years old,
Yeah.
7, 8 years old, and who knows.
Yeah.
But I got it.
Yeah.
And then I always ask, I have more teeth, they're going to fall
Yeah.
off.
I'll have a whole collection at the end.
Yeah. So I was wanted to ask about that, right?
Yeah.
Let's start with something first to know a little bit about you. How did you get into dentistry?
Dentistry, yeah. So when I just have a lot of dentists in my family. So ever since I was little, I had cousins that were in dental school or practicing dentists. And I always saw my parents say like, wow, like, she has such a good lifestyle. She has a work-life balance. And I was like, wow, like I want that. So I started shadowing when I was in like high school, and I shadowed at like a hospital dental program and stuff like that. And I realized like it was really cool, and it was a good mix of like creativity along with like science, which I don't know that a lot of other fields have that. So like you get to work with your hands. If you're making dentures, you can literally like, craft something, or even like doing a filling or anything. So there's a lot of like thinking outside of the box and being able to use your hands as well as knowing a lot about the human body, and, just a mix of all of that. I think that was really cool for me. So
Right.
as I started to shadow, I assisted as I was a dental assistant, and then I got accepted to dental school, and then that was it.
Yeah, that's amazing. So because your family you're used to seeing that so many times,
Yes.
kind of influences you in a subconscious way that, okay,
Exactly.
I'm seeing this, I love
Yeah.
this, what they are doing.
Yeah. And it's like there's like my parents and my brother, they're all in like finance business. So
Okay.
I was like, for some reason, I was never like drawn towards that. And I was always like, okay, healthcare, no matter what. But then like dentistry felt like it for me because it was just such a good mix of everything, you
Right.
know. So
And it's amazing, right? Like you got to serve people and then but at the same time have fun.
yeah, exactly.
The creative part is that you can create dentures or you can create like those night guards and stuff. I don't know,
Yeah,
the
exactly.
impressions.
Yeah, or even
Yeah.
like veneers, crowns. Like there's a lot of like different things that you can do, and it's there's a cool creative aspect to it.
Right. Now, have you heard of this theory that if I don't know you and if you are amongst thousands, I'll not notice you. But now that I know you, even if you're standing among thousands, I'll notice you.
I haven't heard that.
So that's like, try it next time.
Yeah.
If you go to any place, right?
Yeah.
You see like all these famous concert is a bad example because they kind of know where everyone is seated.
Yeah.
And then they give a shout out.
Mm-hmm.
But then if you know somebody, it's very much possible that you'll be able to catch them in like a lot of people.
That's true.
That
Yeah.
face is familiar, so
Yeah.
you'll be able to, you know. Why I said this,
Mm-hmm.
let's go back to teeth. I came to see you, this is like last year,
Okay.
and I learned that my teeth, I have this habit of crunching my teeth.
Yeah.
And that rubs and it creates like a thing, right?
Yeah.
Now I'm going to try and relate that
Mm-hmm.
situation. You told me that because I'm grinding too much, and unknowingly I'm doing it. So I should wear a night guard,
Yeah.
which I do now.
Yeah.
But now a lot of friends around me, I started noticing it.
That they're wearing night guards or
Or
they're clenching.
they're clenching.
Yeah.
One of the friends, his clenching was quite severe, so he was given like guard pretty much all the time. Whenever
Yeah.
he's not eating,
Yeah.
outside of that, or is watching movies or anything, you should just always keep wearing it.
Wow. Yeah.
Yeah, but I started noticing it.
Yeah.
Because now I know that I have that such problem.
Exactly. Yeah.
So that's very common, right?
So what I will say is I've noticed that after like COVID and everything, it's kind of become more common. We're like a lot more stressed. So we're clenching and grinding like subconsciously, but also like all of that happening at night could be related to like airway issues, having like a smaller airway or like have underlying sleep apnea, like obstructive sleep apnea or something like that. So I think it's always been prevalent, but maybe after COVID, I've noticed it more in my patients just because we're maybe more stressed or it was just a stressful time and it created that habit in a lot of people.
Okay.
So that's what I've noticed.
These questions are coming up from, let's say, a Gujarati family, right?
Yeah.
Our parents, my mom used to tell if I drink tea, after I drink tea, I shouldn't drink water. Sometimes they will say drink water first so it doesn't cuts the acidity in the tea.
Yeah.
So our tea have ginger and stuff in it, right?
Yeah.
Again, I was clarified in that last meeting. So
Yeah.
now that you made it clear, it wasn't you.
Yeah.
But I was told that, if after you drink or eat anything, you should gargle.
Yes.
And then you just swallow the water.
Yeah.
But after you eat and drink anything hot or cold, even sweet, gargle it and then do it.
Perfect. Yes.
So that is a myth.
no, that's fact.
No. What I was saying, our parents used to tell us,
Oh, yeah.
or I heard it a lot.
Yeah. That
After you drink tea, don't drink water, right?
Yeah, no.
Immediately.
we want to drink water for
Because
sure.
that creates a stain, is what you used to tell us.
Yeah. It's the complete opposite actually. So
Okay.
anytime we have anything with like, let's say milk, acidity, so like orange juice, sparkling water, or even sweets, so chocolate, banana, whatever. We don't want that sitting on our teeth because that can lead to acidity in the mouth and lead to like low pH, which leads to acidity, breaking down the enamel and cavities. So like it's all breaking down into causing the tooth to demineralize and causing cavities. So what we want to do is get that pH back up after we got it down, after eating, drinking, whatever we did. It's down. We want it back up. The water acts like a buffer and it kind of brings the pH back up. So those cavities aren't starting.
So it doesn't matter if it's hot or cold. You
No.
should just drink water, take
Yeah.
a sip, and always gargle.
Agree.
And then swallow.
Yes, you can
if
swallow
you have
it.
to.
Yeah.
Okay. Yeah. I've been very much doing that.
Yeah.
Ever since I've learned it.
Awesome.
With a night guard. Flossing, such a
Yes.
scary topic for
Yeah.
me. I'm taking me as examples because I've been through all that, so I
Yeah.
know how it works. So my gums are very tight. So the doctor who I saw, she said that I should use the gun,
Yeah.
the water gun,
The water pick. Yeah.
the pick. Yeah, because when she tried to use the traditional thread,
Yeah.
started bleeding, but it would take very much pressure to get it in.
Get down. Yeah.
Which is like, it's probably because the gums are too tight. I mean, their teeth are too
Your
close.
teeth are tight together. Yeah.
So she's like, try that.
Yeah.
A lot of people don't do flossing, right? Like, is it really necessary? Like, what will happen if I don't floss my entire life?
So
Would I see you more often?
I think that brushing, we get the outside, the top, the inside of the teeth. well, what's between the teeth? What's getting between there? The bristles of the brush aren't going to get in between there. So the only thing that gets between is the floss. So implications of not flossing leads to cavities between the teeth, inflamed gums. If there's plaque and food getting stuck underneath the gums and we're not cleaning it out with the floss, that can lead to inflamed gums, lead to gum disease. Over time, that can lead to bone loss, the teeth, having issues down the road as well. So flossing is like super important. Even if, let's say we have to do water floss, or we use those like little picks that like go in that like
toothpicks.
Yeah, the picks, like the green ones with like the little piece of floss on them.
You just hold it like this and just put it in and take it
exactly. Even that's better than not flossing at all. But the best thing is just using string floss and flossing. And the more we floss, the easier it gets. I feel like, because it's really hard. Like initially we're like, oh my God, like I have to go all the way back here. Like it's hard.
Yeah,
but
it's really hard to get all the way back.
Yeah, but like when I started out flossing, I was like 10, 15 minutes. I'm like, oh my God, this is taking so long. But now it's like 2 minutes, like done. You know?
You get used to it.
Exactly. And even that like tightness, I have patients that tell me like it's very tight between the teeth. Like I think the more we do it, like the angle to get in, and then you're able to maybe get into it. But the water pick is also a great option. So
gotcha.
Yeah.
So flossing is not a myth. We should keep doing it.
Yes, we got to keep doing it.
Let's talk a little bit about brushing. I also have a question around that.
Yeah.
The tongue cleaning part, right?
Yeah.
The smell sometimes which people get, is it it's more because of the tongue, or is it actually because of the teeth?
So it really depends on the person. I think mostly it is from the tongue, or it could be like from tonsil stones. Like people don't know that they have like tonsillitis. They have tonsil stones that can cause like a really bad smell as well. But usually it is like not cleaning the tongue. A lot of bacteria is harboring on the tongue itself. So like cleaning it out would definitely, I think, help with bad breath.
Gotcha. And how much time is a decent time to brush your teeth?
Your teeth?
Is there like a standard?
2 minutes.
2 minutes.
2 minutes.
Yeah. If you keep going more than 2 minutes, if you keep pressing it hard, or it's not worth it.
But like the thing with brushing, like we don't want to like, I have a lot of patients that are like brushing like there's no tomorrow, like brushing like crazy, and they're brushing away their enamel, Right. So like soft bristle toothbrush, circular motions like along the gum line and the tooth. So we're cleaning also the gums and also the tooth.
Right.
And gentle motions. Like it's with 2 minutes, we have 4 arches, right? So 30 seconds on each arch. You spend 10 seconds on each surface. So like you can do the outside for 10 seconds, the top where you chew for 10 seconds, inside for 10 seconds.
Right.
That's it. That's all you need. And then you do that in all 4 quadrants. That's it.
Now I have seen people, like some people after every meal, they'll brush.
Yeah.
So and I've also heard that if you keep frequently brushing, you kind of start, getting your teeth rough, because it loses its like the glistening part.
Yeah. Like the
glossy
enamel.
part.
Yeah.
Is it healthy to brush after every single meal?
I don't recommend it. I just say morning and night, and then floss at night. That's it. We don't need to make it complicated. If a person has Invisalign or like aligners and they have to brush before they put the trays back on, then you have to do it. But it's not a requirement, in my opinion, to brush like a million times a day. We gotta just. We know that like life is life, and we're not asking you to stand by the mirror and brush 24/7. Yeah.
Because I've seen it sometimes when you go to work in the office.
People do.
People who are brushing.
And I get patients that are like, I brush 4 times a day, and their like gums are bleeding, and like there's like a million cavities. I'm like, something is wrong then. Like we need to go through your whole routine and understand like if you're spending this much time, and I feel bad because I'm like, they feel like they're doing so much and I still have to diagnose them with cavities, and I'm like, I don't want to do this, but I want you to use your time effectively so that you're helping yourself rather than just brushing and not doing it correctly. You know what I mean? Yeah.
Exactly. There are so many toothpaste. There is Colgate, Crest, so many different types of Pepsodent, like different types of toothpaste.
Yeah.
And they all like say that, okay, there's somewhat advanced whitening, and does it really work?
It does to an extent, because what it does, the whitening is like kind of abrasive on the teeth. So it initially looks white, and then in 2-3 days, it's going to go back to looking how it was, right?
Okay.
So what I recommend to my patients is like using like Crest, like whitening strips, whatever whitening strips you want to use, according to the package instructions, and those have a cumulative effect. So the more you use them, the more whiter your teeth look.
Oh, is it?
Yeah. So I think that's a good option rather than using the whitening toothpaste, because those can cause like sensitivity. The whitening strips can also cause sensitivity, but I've seen I know a lot of patients who brush really hard with the whitening toothpaste and then they have sensitivity. They don't have white teeth and they're like, what's going on? So I'm like, stop using the whitening. Just use regular toothpaste and then supplement with whitening strips.
Okay. Do you when you see people and by the teeth, can you tell a lot about them? Have we reached there?
Yes, I can to an extent. Yes, I can.
Okay. Well, just by looking at the person's teeth, you can tell what kind of a person that is, or what is their personality kind of be, or
kind of like if I see that they have like very flat teeth, I'm like, all right, this person's stressed. Like they're a high functioning individual with like a stressful job. They like, I'm able to, based on how they look and their teeth, I'm like, okay, like I get you got a lot going on.
Right.
You know?
With experience, it becomes
it's
more,
like more. If you show me like pictures, I'll be like, okay, I know what this is. But like, it's hard to off the top of my head. But sometimes,
Hollywood or Bollywood, right? If you were to pick like one person who has the best teeth, just by looking at the person, any one actor.
Oh my God.
Because they do something special with their teeth, right?
They do. Well, they do. They get like veneers. A lot of them either will get veneers or will get like some type of orthodontics to get like super straight teeth or something like that. Yeah.
Like for example, like who would you can even come to your mind?
I don't know. I don't really like watch. Like I do watch, but I don't really pay attention to.
Like the Kardashians, do you think they would do that? They would do that.
They probably have veneers, if I had to guess.
Yeah, because they all look like you can like tell it's not always natural, like what you're born with.
I'm trying to think.
I always get fascinated, like when I see the actors and like when okay, forget about commercial. Even when I'm looking at them giving any interview, I really get fascinated. Like, oh my God, everybody is so clean. How is it possible?
Yeah, it's either I feel like they either got some type of like either they got aligners or brace, like behind the teeth braces is a thing, so you can't even see them, and they could be in that therapy for however many years, and we wouldn't even know, or they just got veneers
because it's just way too perfect.
Yeah, exactly.
It's it's not just like one or two. I cannot pick anyone. Like,
yes.
You look at anyone. Like you look at Priyanka Chopra. You look at look at Dwayne Johnson. Have you seen?
I have seen him.
Oh my God.
Yeah, he has great teeth. He has a great smile.
He has excellent teeth.
Yeah.
And I'm like, oh man, I wish I could have that.
That's true.
Then I learned that there is not. It's not actually. Sometimes it might not.
Yeah.
They might have to do something to their teeth.
Exactly.
Just to make it look so good.
And in LA, where like Hollywood is, or wherever all these people are, they have like dentists that are just like cosmetic, like celebrity dentists and stuff like that. Like they're only tailored to doing that. So like
celebrities.
Yeah. So then they all go there and then they get like the same smile. They all like look the same.
Yeah, they all look the same.
Yeah.
Exactly. I'm like sometimes I feel that way, right?
Yeah.
We can play this game.
Okay.
It's a small game. It's kind of rapid fire, but if you feel like you want to talk a little bit more about it, if it's something more fun to you, go by all means, all right? Right.
Okay.
So this segment is just I'm gonna ask you, throw some questions at you. You respond the best you can, okay?
Okay.
Right. Brushing harder cleans better.
False.
Is it truth or a myth?
Oh, myth.
Myth, okay. You don't need to floss if you brush really well.
Myth.
Whitening toothpaste can damage your teeth.
True.
True, okay. Baby teeth don't matter. They fall out anyway.
Myth.
It's a myth, okay. Chewing ice is bad for your teeth.
True.
It's bad for your teeth?
Yes.
Oh, man. You should brush right after every meal. I asked this to you.
Myth.
You kind of said it's a myth, yeah. Charcoal toothpaste is great for whitening.
Myth.
Okay. Cavities can spread from one tooth to another.
Myth.
Myth, okay. You can skip the dentist if nothing hurts.
Myth.
Myth. Mouthwash can replace brushing.
Myth.
Okay, all right. Time's up. Let's unpack some of them, all right? Some of them, I kind of... You want to pick anyone?
The one before chewing ice.
The baby teeth don't matter.
Yeah. Okay. So when I was in dental school, they showed us this crazy case about a kid he basically passed away because of a tooth infection. And that will stay with me for the rest of my life because he was in an area that there was not enough access to care for dentistry. And I guess his mom couldn't get him to a dentist in time and he had a big infection. I don't remember if it was associated with a baby tooth or a primary tooth. However, any teeth can cause infections and swellings. So we don't want, even whether it's a baby tooth or a permanent tooth, we don't want, when there's a cavity in a tooth, it slowly is in the enamel, then it goes within the tooth all the way to the nerve. When it reaches the nerve gets infected and it can lead to swelling in the area, pus, closing of the airway, like big implications. It can even go to the brain if it's a top tooth.
Wow.
So to me, like any teeth need to be taken care of because we don't know what that can lead to if they're not. So for me, baby teeth, primary teeth, permanent teeth, all of them have to be
taken care of. Okay.
For sure.
I'll come back to this, but I have one more question.
Yeah.
Drinking warm water versus like cold water and then the room temperature.
Yeah.
What do you prefer for yourself? What would you drink
I-
more often?
Room temperature.
Room temperature.
Yeah.
So some people say that cold water is good for you. You should not drink too much of a hot water. It's bad for your teeth.
Yeah.
Any take on that? Any suggestions?
Not really. I feel like whatever you're like, people need to be hydrated. So like drink whatever you want.
People need to chill.
Yeah, that's it. Just drink whatever you want to drink.
Don't overthink
Yeah,
it.
don't overthink it. Like it's just water. Like
Yeah.
it's not like we're adding like
Right.
sugar to it or honey or anything. It's just water. Drink
Right.
however you want it. In
Some
my
people
opinion.
like drinking like cold water with ice in it.
Yeah.
Some people, I prefer room temperature. Normally I'm always drinking room temperature.
Yeah.
But sometimes, like, every once in a blue moon, I'm not big into soda or anything.
Yeah.
But maybe once or twice in a year, when I'm eating a pizza and if I feel like drinking Coke or something,
Yeah.
I'll definitely put ice in it.
Yeah.
It's the only time I consume cold.
Yeah.
Mostly I prefer room temperature.
I think there's no issues with like drinking hot or cold. I know this is like completely off topic, but like in Ayurveda, they say like drinking hot is better than cold and like stuff like that. So like maybe in our roots they knew more than we do, but like right now
Right.
I don't. I think that they're all, as long as you're drinking water, that's all that matters.
It's interesting. Every time I'm getting like doctors or even like physiotherapists and everything, this topic comes up so much.
Yeah.
And this has always been one of my very curious points, connecting science to our Indian roots or Ayurveda or like some things that our parents used to say, right? If you have a toothache, they used to say like clove. Is it true?
It is true. So
And what does it do?
there's an active ingredient, or I don't even know active or what, but there's a part of clove which is called eugenol, which is pain relief. So even today, to this day, in dentistry, we have materials that have eugenol, and that helps with pain.
Oh wow!
So it's like let's say, for example, a patient needs a root canal, they're in pain. We can put, we start the root canal and then we put IRM, which has the eugenol in there, and it helps, to calm everything down. So that's literally clove. It even smells like clove, like loving. Yeah.
It's amazing.
I know.
Yeah.
Yeah. So they knew back then somehow, and we still use it to this day.
Right.
Yeah.
How much do you, despite knowing like a lot of about, now you're a doctor, so you already know a lot. Do you ever feel like, whatever your parents sometimes they said, after learning so much,
Yeah.
after being a doctor,
It
you
brings
still
me
feel-
back. Yeah. So there was one time where I got my wisdom teeth out, and my mom had said fatakri na kogra kar. So fatakri is like boric acid, or I believe, or alum or something. I don't even know. Alum powder. And I was like, no, I was in dental school. I was like, no, mom, I just have to do warm saltwater rinses. You don't know what you're talking about. And so whatever, that was done. And then I was in clinic. I was in my last year of dental school, and one of my faculty was he was telling me about random stuff, and he was actually it's called alum, because he was talking about alum powder. I was like, oh, is that, and he was Gujarati, and so I was like, is that fatakri? And he's like, yeah. And I was like, oh, my mom told me about that 2 years ago, and I didn't even believe her.
He started it.
Yeah, and it's true. So it helps with healing and stuff like that. So
Oh, right.
I don't know how they know, but sometimes they know certain things.
They know, yeah. This has been passed on to them.
Yeah.
Maybe they also don't overthink too much. We overthink a lot.
Yeah,
I
we
feel.
do. And we're like, oh, does it, we have to Google this before we do it. We do overthink a lot, I think.
I read, all it takes me is just one post.
Yeah.
Now that I'm on social media back again. I was social media sober for almost 6, 7, 8 years.
Oh, wow.
Now it's become my game because I have to be in it. So if I'm in it, I might as well learn and stay up to date, right?
Yeah.
It just takes me one post to throw something out of the house.
Literally.
And then
Yeah.
after a few days, that post becomes positive. Then I bring it all back.
Exactly. We trust it so much.
Yeah.
That's me with TikToks. I'm like, oh my God, this TikTok said this, so I have to buy it, or I have to do that. It's really bad.
Yeah,
honestly.
that has ruined things for me.
Yeah.
I mean, everything I used to think was safe, then all of a sudden became unsafe.
Yeah.
And that's why I do this. That I can actually talk to
Yeah.
certified people
Yeah.
who actually know what they're talking about.
That's true.
Instead of me trying to rely on my brain and
Yeah.
social
Random
media.
people on the internet.
And
Oops,
social
sorry.
media university, right? So
Yeah.
You also paused when I asked you about chewing ice can be bad.
Yes.
It's water, but why would it be bad?
So it can just chip your teeth.
So same thing what crunching does.
Yeah, like clenching. Yeah.
Clenching.
Yeah. So
Hard.
it can cause chips, and we don't want that. Like it's the same thing as like people saying they're opening a beer bottle with like their teeth. Like it's gonna cause some type of fracture or something.
That's
and
bad, yeah.
Yeah. So same type of thing.
One food that everyone should avoid.
To help
You can
their
give
teeth.
5, but
Yeah.
like just for the sake of your tooth care, like there's one food that you feel like strongly people should avoid.
I think everyone can eat everything as long as they're cleaning their teeth properly afterwards.
Oh, is it okay?
Yeah. So like there's not one thing that I don't eat personally, but I think that there are specific things that after I eat them, I'm super careful. So let's say like any type of gummies that like stick to your teeth.
Yeah.
Chips, Cheetos,
Chips meaning like Lay's and stuff
Lay's,
like
yeah, like Cheez-Its.
Doritos,
All of these
Cheez-Its.
things that like are sticking on our teeth, those are carbs that are breaking down and it's going to start cavities. So
Right.
as soon as I have those things, I'm rinsing my mouth with water, and then as soon as I can, I brush my teeth.
Yeah.
That's it.
You know how I judge that? Every time I eat something, I judge by how it gets stuck on my fingers.
Yeah.
If it's here, it's going to be here.
It's going to be here. Yeah,
So
probably.
like
yeah.
Cheetos is one example.
Exactly.
Pizza, because there's so much oil and grease. If it's in my hand, I feel it's going to be here.
Yeah.
So I might just...
The pizza is actually not that bad because it's cheese is protein. So like that's good.
Right.
The bread is like, okay, like it can.
No, I mean
like,
it gets stuck. I mean like...
Oh, as in getting stuck like between
on
your
my teeth and everywhere.
Yeah,
Like
yeah,
if it's
yeah.
oily,
Then
I
it'll.
feel like it will stay here.
Yeah, that makes
and
sense.
Then I try to like...
Clean
go
it
and
off. Yeah.
Take an extra mile.
Yeah.
To take care of
exactly.
such situations.
Yeah.
Not every situation, but I try to tend to think about
Yeah.
that.
We do our best. Yeah.
Yeah. One more thing.
Yeah.
You also took a pause at this one, charcoal toothpaste.
I don't know why.
It's great for whitening.
Yeah, it's not. So it's become such a like wow, like charcoal.
It's become
toothpaste.
a phenomenon, right?
Yeah, but it's like it's not. It's just you're having like the dark stuff on your teeth and then you rinse it off. So yeah, they're gonna look whiter, but it's not whitening. It's super abrasive on the teeth, on the enamel. So
Alright.
it's not.
It's not the toothpaste, it's a mind playing trick.
Yeah, exactly. It's
control
even
your
like that
mind.
purple toothpaste. Like, yeah, we see purple and then we'll see white. So then it'll
Yeah.
look whiter in comparison, but it's not really doing
Right.
anything, you know?
If you think about it in the flip second, that does make sense.
Yeah.
Right? If you put anything on it and if you just rinse it, it's going to become the...
It's going to look nice. Like,
Normal
wow,
color.
it looks white. Yeah.
Yeah.
Exactly.
A lot of toothpaste claim that whitening, but then I also read somewhere, again, there was some
Yeah.
post that I came across which says that if you use the whitening toothpaste, over time your teeth can be damaged
Yeah. It
because
can.
of something in the toothpaste.
Yeah. So they're, again, like the whitening agents are pretty abrasive on the enamel, leads to sensitivity. It's kind of similar to the charcoal where over time we're not going to see that whitening effect as much and it can lead to sensitivity as well.
Do you have like any preferred toothpaste company that like probably, again, we're not sponsored.
Yeah. Not sponsored.
Dr. Roshni has to
Um,
throw any light on anything.
I just use like regular, like Crest Colgate,
Crest
like nothing
Colgate.
crazy at all. Yeah.
Okay, awesome. Brands and ads,
Mhm.
right? They come up with so many different types of toothpaste. Like for kids, they are different. For adults, they are different. For elderly, they are different, right? Similar to that, you said use soft bristles
Bristle.
brush.
Yeah.
Is it for all the age group, or is it like when you're younger, you can use the stronger?
I think everyone should use soft bristled and just because it's more gentle, like the hard, if you feel like the hard bristle, it's like very hard. It's I think it would be too hard on the gums.
Okay.
So
Why do companies still build like firm and
that's a great question.
soft and
I don't know.
I
Honestly.
just ask doctors, like
Yeah.
they can tell you what to build and
Yeah.
then you build that.
Exactly.
You'll
Yeah.
sell better.
I think in certain circumstances, people use a hard bristled brush. I can't think of it, but I did have a patient who was using it for a specific reason and it was helpful for them. But
Okay.
it's like very rare. Like mostly we just say like soft and that's it. That's perfect.
Okay, perfect. Let's go a little bit back in time.
Mm-hmm.
Every subject has history of where it started. So fun stuff. Like I was talking about firefighting. One of the marshal was one of my guests.
Yeah. Yeah.
He featured in one of the last episodes. And he was so quick and fun. He was so curious. He was telling me he had his 120 years ago, his great-great-grandfather was a firefighter.
Mm-hmm.
And he had a uniform and everything.
Mm-hmm.
And it's really cool that, that point of time. And we were talking
Yeah.
about the history of firefighting, where
Yeah.
it came from.
Wow.
He said it date back to like years back.
Yeah.
Where they used to I don't actually now remember what century you was talking about, but it dates that back.
Yeah.
Do you study history of dentistry
So-
when you go to school?
We had like a course where we started out, like the first lecture was like history of dentistry. Like it used to be that like we didn't have anesthetic or like any type of injections back in the past. So they used to give the patients like cocaine, or they would like just like take a swig of alcohol, and then they would do whatever, take out a tooth or whatever they needed to do. I know in the past, dentists and barbers used to be one and the same.
Oh, is it?
Yeah. So that was something that we
Whoa,
learned.
that's
yeah.
a fact.
Yeah.
That's a cool fact.
And then
So seriously, like, so dentist would be the barber and barber would say they would be
barber
the same.
and dentist,
They could
it's
do
all
both?
in one. Yeah.
What's the relation? One is hair, one
It's
is...
head and neck
Oh my God.
all
that's
in one.
amazing.
Yeah.
So
One
funny.
stop shop. You get everything done, I guess. Yeah.
Oh, wow. Do you know when they stopped
I don't know.
differentiating and be like, no.
Probably,
you
if I
can't
had to
handle tooth.
guess, like maybe like 1900s, they were like, all right, like
Oh,
we got to.
that recent?
No. Maybe I got to Google it. I don't know.
1800 maybe.
Yeah. Maybe 1800s. Yeah.
If in the audience, if anybody knows, put in the
Yeah,
comment
let us
section.
know.
Yeah, let us know. We'll read your comments.
What else? There were, I think the main thing was like we didn't have good like pain management back then, so they just did what had to be done to, you know.
I feel like one thing that, as mostly for all the internal body, I feel hygiene is such a big part, right?
Yeah.
Back then, there was not too much of a hygiene as such, right?
I don't think as much that, I don't know even if they like brush their teeth, like, or they had that routine of like brush twice a day, floss at night. I don't think they really had that back like in the beginning. But what I will say is right now, the stuff that we're eating leads to more cavities, but their diet back then was probably more simple.
Yeah.
And so it probably didn't lead to as many like issues. Maybe.
Okay.
Yeah, maybe. I don't know.
Right.
I just feel like we have a lot of carbs and sugars and all of that. And so that leads to more prevalence.
Like a lot of stuff is
of
sometimes with
cavities.
soda in it,
Yeah.
eating South Indian food and to get like that yeast.
Yeah.
All those
Yeah.
things could be a little bit acidic for your tooth. Sometimes
It-
maybe.
Maybe. Yeah.
Ajinomoto could be another one.
Maybe. Yeah.
That could.
So I think it's just a little different, the diet back then and just the lifestyle back then and what we have now.
Okay. All right.
So, yeah.
Yeah. So it traces back. I'm going to leave it to that. It
Yeah.
traces back by the barbers and the dentists were same.
They were all the same. Yeah.
And at some point, some genius might have figured out, no,
Like we need
if
to
it's
make
something
this.
inside, let's not touch
Yeah.
anything with that. Yeah.
Exactly.
And so let's talk a little bit about AI. We are in the age of AI. And is it making your work easier? Is it making your work harder? It's not there yet.
It's kind of there. We have like some programs that help with patient education. Like we show the x-rays. It's like a HIPAA compliant platform where the x-rays get uploaded, and then that shows if there's any cavities on the x-ray. So it helps with patient education because we show this is your x-ray, this is the teeth, you know, the upper right, and then this is where we see, you know, a cavity. And they're able to see the outline of the cavity and how it looks different from everything else. And they're like, oh, okay, that makes sense that, you know, I have a cavity. Other than that, there's not really, I know some practices are doing like an AI based like receptionist or something like that. I haven't experienced that, but I've heard of that.
Okay.
Other than that, we don't really.
Do you feel this dentist is much more hands-on because
Yeah.
you feel like it physically in person?
Yeah.
If you have to operate or if you have to do a root canal, you cannot use robotics, right?
So implants, like dental implants, we have robots that can place them.
Oh, is it?
Yeah. We
Okay.
have some robots. But it just, if the dental practice has it, then they can use that in order to police it. But other than that, everything else is done like in person. There's nothing
Do you have
else.
patients who choose to not do that and just take a doctor
Yeah.
physically do it?
Yeah, I'm sure. Yeah. If they're given the choice, then they can choose like, oh, I want a robot or I want a real trained person. Yeah.
Okay.
Yeah. But I think the robot, I'm not too familiar, but I think the person, like the doctor, like manipulates it and they just it just has a good precision in order to like the angle of the implant, they're able to place it into the bone.
Gotcha.
I think that's how it works. I haven't used it personally.
The robot part?
Yeah.
Okay. What's the most common question you get asked by patients?
How can I whiten my teeth? I think the
I think I
whitening.
also asked the same question.
Yeah.
How can I get my teeth
Yeah.
whitened?
I think that's probably the most common.
It was a movie that I saw right
Okay.
before I came in for my tooth
Yeah.
annual checkup and annual cleaning,
Hmm.
and I saw it and I was like, "Can I get that?"
Yeah.
And they're like, "First stop, clenching your teeth.
Yeah, exactly.
Let's fix that first.
Yeah. And also like that's not real. So,
That's not real."
yes.
Yeah. What? Can I just? I don't want to know yours or anything particular, but do dentists make a lot of money from just being a dentist or practicing somewhere? Okay,
Yeah.
not your own practice.
Not your own practice. So what I didn't know going into becoming a dentist, like no one told me this, but you don't necessarily get like a base salary. Like, let's say you're in finance or something, like you get a nice like yearly salary, you get benefits, 401k, all of that. Dentistry doesn't necessarily have that if you're working at a small private practice. You get paid on a percentage basis of what
Okay.
you do. That's typically how it is.
Okay.
And then benefits, 401k, medical, dental, like all of those things don't really come into the picture unless you're working for like a big corporation. So that was
Gotcha.
something I didn't really know
Okay.
before I came in,
Okay. So
was looking
folks should
for.
know that if
Yeah.
you're expecting right off the back,
Yeah.
unless you already have somebody in your family who has a practice.
Yeah. And you're joining them, then,
That's
that
a
would be
different
a little
story.
different. Yeah.
Yeah. Do you think with like so much not modernization, but like so much commercialization, are people now more aware, or they still take it lightly when it comes to like tooth care?
I think that with all these, there's like dental spas opening up, people are more
What's a dental spa?
like there's like certain offices that have like they like you go in, they have like a massage chair, they'll like put on Netflix, you get like a hot blanket, you get like it's like a spa experience. Like I've seen dentists that like they'll have like a lady doing your manicure while you're in the chair. Like it's crazy.
It's called a dental spa?
Yeah.
Damn.
So they have some of those. So like I think that's like maybe bringing back people wanting to go to the dentist, because it is very, it can be a vulnerable time for a patient when they come in and they're like, I don't know what's going on and I'm scared, and they're scared of an injection, they're scared of seeing the dentist, or they don't want to experience pain, or I've seen a lot of those patients. So
Yeah.
maybe creating like a welcoming environment for them where they feel more relaxed maybe is a better thing. So maybe patients are, gravitating towards practices like that. But I don't know. I think people are mostly like, if you've been raised to go to the dentist every 6 months, and you're going to continue to do that. But there's people that were never really started off with that. So then they haven't been prioritizing it their whole life. So then they'll only go in when like something hurts.
Yeah, something aches. Yeah.
Exactly. So
Right.
it just really depends on, how they were raised and, what they're used to.
Okay. Can we talk a little bit about like Asia, like India and let's say here?
Yeah.
Is it that's when the difference comes into play, right? I don't remember, like, if I was never told to go after every 6 months.
Yeah.
I learned it when I started doing it like a few years ago,
Yeah.
that I should take care.
Mhm.
Doesn't matter if I'm young or old.
Yeah.
If you take care from now, when elderly, you'll be fine.
You'll have all your teeth. Exactly.
Or even more than that, you will know when to panic and when to not panic.
Yeah, that's
Which
true.
90% of you don't need to panic, but because you don't know, that's why you panic.
Exactly. That's very true.
Yeah.
I think in India, I don't know much about the dental landscape there, but I do know that it's mostly on an emergency basis. So people will go when they have pain, and they don't really care about like every 6 months, like this is important, or even brushing twice a day. Like my dad was telling me, like he didn't know that you had to brush twice a day until he came here. Like
Right.
that wasn't something that was instilled in them when
Right.
they were in India. So I think it's just like a little bit different how people are taught over there versus like here. Like when I was in college, I was like the president of a club where we would go to elementary schools and teach kids about the importance of brushing and flossing. And, it was just, it's much more prevalent here that we care and we want to instill it at a
Right.
young age,
Right.
Yeah.
In my school, I remember I used to study in Delhi Public School in Ahmedabad.
Yeah.
And there was a time when the dentist would come. They
Yeah.
would bring like the like the tooth, the fake tooth.
Yeah.
They'll show us like how to brush
Oh, that's
top,
awesome.
how to brush from bottom,
Yeah.
how to do inside,
Mhm.
outside. So they would like do it.
Yeah.
So I remember then.
Okay.
Ever since then, it's stuck in my head when I was young.
Yeah.
Of like the motion of how to brush and how to go all the way at the back.
Yeah.
So we did all that,
Okay.
but not the physical go and see the doctor every 6 months.
Okay. I see.
That's not something that they told, or maybe I don't even remember if they said it or not.
Yeah.
But at least the school took an initiative.
Yeah,
and
that's great.
That got stuck in my mind.
Yeah.
This is I'm talking about when I was in 8th or 9th grade, maybe
Wow.
like 7th or 8th or 9th grade.
Yeah, yeah, yeah.
When they would invite these people and then they would like do it.
That's phenomenal. I like that.
Now, fact or not, if you were to brush only one time, you do it at night.
Agreed. Fact. Because we don't we eat all day. We ate breakfast, lunch, dinner. Then we're going to go, we brush, let's say we only brush in the morning. We brush in the morning, breakfast, lunch, dinner. Then we're not brushing until the following morning. All night, all the food from the whole day rotted between our teeth.
Right.
Whereas we eat breakfast, lunch, dinner, brush at night, everything is clean. We start off on a clean slate the next morning. Even if you don't brush, ideally you brush, but even if you don't, you still have a clean mouth for when you start the next day. So in my opinion, if you had to, gun on your head, you had to brush only one time a day, it would be at night.
Do it at night.
Yeah.
Yeah, okay, gotcha. So brushing twice a day is like really important.
It's perfect, yeah.
But if you are doing only once, especially do it at night.
Yeah.
But
then also at night, there's bacteria in your mouth, plaque is going all on your teeth. Don't you want to start the day with fresh mouth as well? So in my opinion, why not do both?
I think it's a trick that dentists play. Because if you brush at night, it's not possible that you not brush in the morning. Because you are by default tuned in to brush every morning.
That's a habit. Yeah, exactly.
So you will brush.
Yeah.
You might not shower sometimes, but you will brush the first thing.
Yeah.
I also one more fun question.
Mm-hmm.
A lot of people break up in the morning, drink orange juice, coffee, and then go and brush. And then people like me, I like to brush first and then start my day.
Yeah.
Any difference in the two?
I agree with brushing first and then going for it. So orange juice is acidic, or I know
Anything
everyone
you
doesn't
drink or
have.
eat.
Yeah. If we do brush after having orange juice, that's not good because it's acidic. We're keeping that on our teeth and then brushing with the acidity and all that. So,
Right.
But even in general, I would just rather brush first. It's not the biggest deal in the world if you brush after, but I don't know. It's personal preference, I would say.
But we should always, you feel like we should brush and then drink or coffee or something, right?
Yeah.
Because I know people who do that.
Yeah.
They first.
I don't think there's anything necessarily wrong, especially if they brushed the night before, then it's not the biggest deal in the world.
If you brush at night, that's a different story.
Yes.
One very important topic, smoking, and not just for lungs and everything. What does it do? Does it affect your tooth and your overall mouth in any?
So yellowing of the teeth, bad breath can lead to gum disease. So bone loss over time leads to losing the teeth because they get loose over time. So those are the main implications of smoking on oral health.
Okay.
I've had a lot of patients in the past that lost their teeth because of smoking over time, just over years and years and years of smoking, many packs a year.
Right.
So that's just.
And this thing about this new thing, which is like the vaping.
Yeah.
Is that equally bad?
Yeah.
Smoke wise?
It is. So smoking, alcohol are two things that are known to cause or can cause oral cancer. So
Okay.
In that regard, it's very, very bad, especially if someone is doing both together, then that can even increase the chance of oral cancer.
Okay.
This with vaping, there's not that many studies yet, but it's probably likely the same implication. So when a patient tells me they're vaping, then I'm like, please don't. Please don't.
Stop, yeah.
It's kind of even worse than smoking because we don't have enough research on it. So
right.
It could be even worse than smoking and we
Yeah.
don't know. So it's better to just not do it.
With
And
smoking, there are studies, so you can actually go back and look at the procedure,
exactly.
what to do in this situation.
Yeah, and it's just more concrete evidence. This truly clearly shows in thousands and thousands of patients this leads to that.
Right.
Whereas vaping, we just don't have that research yet, but I'm sure it'll come soon where it shows basically the same thing.
Okay. One more thing. They also do hookah.
Yeah.
Hookah is basically the same thing as vaping, right?
It's smoke, right?
It's smoke.
Yeah, but
And
like
they use those
the-
tall
the-
things and
yeah.
then the pipe.
yeah, I don't know if there is like nicotine or tobacco in there or what. Like I don't in the hookah.
But my main thing is that it's still vapor.
Yeah,
You're-
it's like
you're
some type
inhaling,
of
taking vapor through
yeah.
your mouth.
Yeah.
So that still falls under the
It's
same.
still not good for you. Yeah,
Okay.
for sure.
And then if let's say somebody's doing it, is there anything that they can do to prevent their teeth,
No,
or is it just you're
just
done?
stop doing the thing.
Okay.
Yeah.
Yeah. That's what I tell
Yeah.
whoever I know.
Yeah.
Are there any treatments or trends that people should avoid, according to you? You spoke about a little bit about those LA doctors or like cosmetic dentists.
Yeah, I the thing is like I'm sure those dentists are doing it within like the right, the standard procedure and everything, and they don't want to cause any problems down the road, so they're doing it correctly. I just think that when it comes to doing like veneers for a cosmetic reason and everything, a lot of the smiles end up looking the same because it's like
Okay.
they do like the same shade because everyone wants to have that like Hollywood smile. So it ends
Right.
up looking the same, but there's nothing necessarily wrong as long as the person is happy with what they got,
Let me ask this question a different way.
Yeah.
There's this machine where you put your clinch your tooth in, press the button, and you take it out, and your teeth becomes white.
Oh, the white. Yeah. It's like a
Are
light.
those the strips?
So there's like a gel that you can put on the teeth, and then there's like a light that comes with it to activate the gel. I don't think the light is necessarily needed, but like it can help with whitening. So like
Okay.
nothing wrong with that.
I think it's a great time. I think
Yeah.
What do you think? How did it go? It was
I
the
think it
first
went
podcast.
great. Yeah, I think it went great.
You like it?
Yeah.
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 When I was preparing for the podcast,
Yeah.
normally the way it works is like I know what I'm gonna do,
Mm-hmm.
and then a day before, everything goes to drain.
Mm-hmm.
I think I want to do it this way now.
Okay.
That tens and thousands of ideas that I get in my
yes.
mind,
Yes.
and then I have to narrow it down,
Yeah.
and it's mostly to what I originally had planned on doing.
Okay.
So I think it was good execution.
Yeah.
I had
Okay.
fun.
Awesome.
I learned so much
Yes.
from you. So thank you so much for doing this.
No problem.
And
Of course.
I hope few years down the line, when we have our own bigger studio, we get to
Yes.
bring you back.
That would be great.
And we'll talk about your experiences.
Yeah.
You would have also you might have your own practice by then. who
Hopefully,
knows?
yeah.
And we'll keep our fingers crossed for that,
Yes.
right?
Yes.
So I hope you guys enjoyed it. There were so many myths that were busted for me today. I bet a lot of you didn't know the barbers were your dentists. So next time you go and see your barber, tell them that, Share this. And if you like this, please comment your best parts in the comments. If you like it, please share, subscribe to the channel, and give this video a thumbs up so that, it keeps on bumping up. And I'll see you in the next episode. This is your host, Halak, signing off. Thank you.